Hi, this is Group 11A's IPTS presentation, and you can see all of our names below for 11A. You'll go to the next slide. So the first topic that we have to tackle before we get into our official case and plan would be addressing the question of what is radical belonging. So to us, our definition of radical belonging is a concept of inclusivity that also takes into consideration the relationship between social, academic, and democratic factors. And this is within the group that it's being considered. These factors not only include things such as education level, socioeconomic status, et cetera, but also appreciate the value of diversity of a group's lived experiences and uniqueness of each member of the team, and perceives this as a strength of the team. Medicine is traditionally a hierarchical field, which can make belonging sometimes low on the priority list. And as we know today, patient care is extremely complex, and many people make up the team that delivers high quality care to patients. So this concept of radical belonging is something that should be applied to team-based healthcare. Every team member should feel that they can bring their whole self to work every day, because this leads to maximum participation and feedback from the entire group, which is necessary to have a safe and high quality level of patient care.
Okay, so our comprehensive proposal to support radical belonging at M Health Fairview includes 3 levels of implementation. One level would be organization, another level would be the team level, and the third would be the individual level. We did most of our proposals in the organizational level because we hope that these would be the most far-reaching and have the greatest effects. So for our proposals for the organization level, first we want to ensure pay equality. So making sure that all employees are receiving equal pay in the same positions, and then also making sure that M Health Fairview is compensating their employees appropriately. So their wages are comparable to what another health organization would pay this employee for the same job. And then we also want to have a town hall, which is basically a safe space in the workplace, either in person or via Zoom, where employees can air their grievances about things that are happening that they dislike in the workplace. And then also hopefully from these conversations can lead to like actionable items that the workplace can implement to make things better for the employees. And this would be really great because it's employee driven. And then we would follow up the progress of these actionable items that were implemented after the town hall with quarterly employee pulse surveys, just to monitor the satisfaction with these new implementation programs, how we can change them and modify them and make them better based on what the employees are experiencing. And then we also want to make sure that there's a formal and established channel to report workplace misconduct. Much like SLU has the Office of Professional Oversight, we want to make sure that there's something similar at M Health Fairview, just to make sure that people are being held accountable in the workplace. And you can submit complaints either anonymously or not. And even if there isn't like punishment indicated for the individual for whom the claim was filed against, there's still going to be follow-up with the individual about the claim that was filed against them. And then as M Health Fairview continues to hire, we want to make sure that there's diversity in their leadership roles. M Health Fairview has a diverse employee basis already, so we want to make sure that leadership reflects that, and that can also help inspire employees to, if they so choose, obtain leadership roles one day. At the team level, we thought it would be nice if we celebrated all holidays in the workplace, especially holidays that are important to those employees in that team, and maybe with each of those holidays there could be a flyer that the employee fills out that just, talks about the importance of this holiday in their culture and what their cultural identity means to them. And then at the individual basis, a lot of organizations and companies are now implementing like diversity, equity, and inclusion training programs. So during that, we thought we could really encourage individuals to explore their own unconscious biases, because understanding and recognizing that you have a bias is the first step leading to change. And so hopefully that would lead to more cohesiveness and respect within the workplace.
And so before we kind of implement these interventions, we have to first understand where these inequalities lie, specifically with the COVID-19 pandemic that kind of heightened a lot of the inequalities that were already present within our society and specifically within the healthcare system. As a result of the pandemic, the employment sectors that were most affected were actually those that hired a greater proportion of individuals of color and women, which resulted in a higher proportion of individuals of color and women losing their jobs during the pandemic. We've also seen a rise in Asian American discrimination during the pandemic as a recent poll found that 30% of Americans blame China or Chinese people for the pandemic. And about 32% of Americans have claimed to actually witness this blame occur firsthand. There's also been significant pressure on women to work from home in order to provide care for individuals that may be at home, children, elderly parents. And as a result of a lot of daycare agencies and childcare organizations having to shut down during the pandemic, the pressure has been placed on women to be the ones that go home and care for these tasks. And then the last couple bullet points here just talk about how different populations have a lot of the same difficulties that have come from the pandemic. We know that individuals of marginalized populations, such as African American adults, Latino individuals, women, Asian Americans, many of these individuals are more at risk for developing COVID in the first place and are more at risk for developing severe infections. So we'll head over to the next slide where we'll talk about what we can actually do about these inequalities. So as Maddie mentioned, annual diversity and inclusion trainings for all employees would be beneficial, especially when combined with team meetings to discuss issues that individuals have in the workplace and outside of the workplace, and coming up with solutions for these problems. We could also bring in leaders of local and national organizations that are designed to promote diversity, inclusion, and equality within the healthcare system. Establishing support groups and on-call psychologists to address that mental health aspect that has been associated with the COVID-19 pandemic and its effect on individuals within certain populations. And I think one of the biggest things that we'll need to do at M Health Fairview in order to create an environment that promotes radical belonging is trying to have a better understanding of individuals' values and beliefs, and the differences where those differences lie. And so having meetings with our employees to try to understand where those differences lie, what difficulties the individuals next to us and that we work with may be having, can help us create a physical environment that accommodates for these needs. So whether that's establishing private rooms for prayer during the workday, creating a dress code that is comfortable for all individuals and that all individuals feel meets their needs based on their individual preferences, would be very important to create an environment that everyone feels comfortable in and can perform their duties to the best of their abilities. And then finally, as I touched on earlier, with daycare and caregiver organizations kind of shutting down and being harder to access during the pandemic, we could partner with these agencies to provide discounted services or some sort of support for our employees so that they don't have to make those difficult decisions of stepping away from work or taking time off of work to care for the people at home. And then finally, something to at least consider would be to provide health insurance to all our employees and their families as a part of a benefits program. And all of these things combined would help to just create an environment where employees feel that they are cared about and that they are treated holistically, just like we treat our patients.
So in terms of short-term implementation of our plan, we think it's very important that employees receive an explanation as to why the changes are being made and why they're important. It's also important that employees receive a copy of these new policies. So for most companies, an email, electronic version of the handbook might be most appropriate. And then also making sure that employees are aware of everything that's expected of them. Requiring an acknowledgement of the policies may be appropriate, for example, an electronic signature, just to make sure that everyone can be held accountable for promoting the plan. And then we hope that change in pay, we hope that only an increase in pay would result from our policy, but regardless, it's important that everyone is alerted if there's a change in their salary or pay. And then we also want to make sure that there's a direct channels that employees can use to submit any questions or concerns they have about the plan initially. And then looking more towards the long term, we mentioned diversity training earlier, and we want to make sure that qualified people are leading these, and these may be people outside of the health system. And it's also important to provide several dates throughout the year just to ensure that we're accommodating everyone's schedule. And then we also mentioned town hall meetings. We need to make sure that these are being planned thoroughly and that the times and dates are well communicated. And then the quarterly pulse surveys also need to be generated, and for most companies, sending them via email would probably be the most convenient way. And then we also suggest incentivizing employees to participate in the town hall meetings and surveys. For example, everyone who filled out the survey could be entered into a raffle, or gift cards could be given out at the town hall meetings. Just things like that, especially in the beginning, will be important to get everyone involved. And then, as we mentioned earlier, we want to make sure that we're receiving employee feedback about which holidays they would like to celebrate and whether or not they want to. Some employees may not want to celebrate their holiday at work. And then we want to make sure that we are appropriately representing these holidays and that educated people are doing the decorations and the execution. And then finally, we want to make sure that we have a formal misconduct policy drawn up. So that way, if any employees are not compliant, then we will have that to refer to. And I think another important consideration is to create either a committee or just a new job title to execute all of these different tasks, just to make sure that nothing is being neglected or people that are already busy aren't, nothing's being added to their workload. So hiring new people or a task force for this new policy might be the best, just to make sure there is someone who's generating the poll surveys, someone's in charge of the diversity training, organizing the holidays, and responding to feedback, just to make sure that everything is done and everyone knows what their responsibility is. And then the interprofessional team will support the implementation by treating each member equally and with respect. So treating nurses with the same amount of respect as the physicians, for example, recognizing that every role is critical to the team. And I think the key here is to create more diverse teams and promote open and honest communication, because this will allow for more ideas, greater perspectives, and ultimately this will only better patient care and patient health outcomes.
So a little bit about the metrics of success that we'll be using. So the first thing that we would want to employ is the employee satisfaction index. So in a general sense, employee satisfaction is how happy employees are with their job and their work environment. And there are many different factors that go into employee satisfaction, including remuneration, stress, leadership, employee experience, company culture, work-life balance, etc. But a lot of these things are really difficult to measure. Some things that we can measure are absenteeism, and that would be the number of absent days measured against the number of available work days in a given period. Higher rates of absenteeism usually result in a greater workload for the employees that are there, and that would cause more stress and job dissatisfaction. So a lower rate would indicate trends towards success. And something else that we would be able to measure is employee turnover rate. That would be the number of terminations during a period measured against the number of employees at the beginning of the period. Turnover results in high costs for organizations, and lower turnover usually leads to less disruption, greater productivity, and more cohesion in the workplace. And with higher employee satisfaction, employees are less likely to resign. Complaints are pretty self-explanatory. Employees that are generally unhappy with their job will definitely complain more, but also just giving employees an open space to submit their complaints is also important as well. And then for surveys, we would want to employ something long-term, and then also something called always on. Traditional annual surveys for employee engagement and satisfaction are definitely important, but if an employee is unhappy, the changes from the annual survey may be too late. So something that's always on, that's either administered weekly or daily, just as little pop-ups that act as small check-ins with employees could definitely be helpful. Just asking if they're satisfied with what they're doing today. Do they feel like they're getting the necessary training every day? Could help us see how employees are feeling about their jobs. And then patient outcomes are inevitably tied to employee satisfaction, and definitely need to be a metric of success, especially in healthcare. Things that can be measured are clinical outcomes, including readmission rates, as well as length of hospital stays for certain medical problems. The number of adverse events, including falls, hospital infections, and then also medication errors, mortality rates, which measures the percentage of patients who die before being discharged. And then last but not least, patient experience and satisfaction, which assesses the patient's perception of their healthcare.
So as far as the sustainability and scalability of the project to other healthcare settings, one of the key parts of this is making sure the goals of the proposal are normalized and become consistently part of everyday practice so this can be achieved. One way of doing this is just having active participation of all members in the community in the healthcare setting. And this includes those with lower socioeconomic status and representation to help reduce these inequalities that exist. I think through a proposal, participation is encouraged. For example, with patient outcomes and employee satisfaction that are used as metrics of success, hearing the grievances through town halls and official channels, and then also the other proposals we've mentioned, like educating employees about the proposal or allowing them a channel to ask questions about the proposal initially. And in this way, self-advocacy for people of different communities will increase. This allows people to speak up in lower represented groups. The discrepancies that persist can be analyzed and then researched, continue to find work that continues to resolve these problems. Because through a proposal as this one, checking off a box isn't really a good way of enacting it or allowing it to be sustainable. It's just, you need constant monitoring and constant observation to make sure that this stays sustainable. So although scaling up innovation as this one requires more resources, more reallocation, and more advocacy, this can be overcome with increased awareness of these inequalities through participation and self-advocacy. And these improvements will eventually become common and become common ethical practice in medicine.
I want to talk a little bit about what we learned during this process. What we found to be effective or needed for effective teamwork is having a common goal and culture where employees feel that they're valued and belong. That being the goal, that employees feel that they're valued and belong, and that we agree on that as the thing that we're striving for. A second part of that is buy-in from each member of the team. So a culture where team members feel that they're responsible and they want to participate and grow this culture of radical belonging that we talked about in the beginning. In addition, we found that a platform where each team member can voice their ideas is very important. As we've had in this presentation and as we've had throughout our sessions, we've had a platform where each person on the team can voice their ideas and they're given the time and space to be heard and go from there. Another thing that's important is a leadership that points the team towards the goal and delegates responsibility. So when you have a big team, it can be difficult to remember what the common goal is. Each person is completing their own part of the task, but just having leadership that points the team towards the goal, but that doesn't micromanage each member, that trusts each member to complete their responsibilities and encourages those members in their responsibilities, but that does not micromanage and take over. And I think this leads to employees feeling that their contributions are valued. This next part is kind of part and parcel with the previous shared decision making. So when major decisions are to be made, that each member of the team feels that their contribution is valued and that they're being heard and that their ideas are given a place. And finally, tangible growth is really important for effective teamwork. If we are creating interventions and plans and we don't see any outcomes, it's very easy to burn out, to lose motivation. I think we can see that in some of the interventions introduced during COVID, where there was healthcare teams being recognized, in the news and with signs and things. And when little implementation was actually seen in the facility itself, and members were still having difficult times getting childcare or having proper staffing on the teams, it led to burnout because it felt like leaders had something to say, but didn't actually make any change. So having tangible growth is very important. And our final slide is our references here. Thanks for listening to our presentation and have a great day.